Imagine lying on a wooden table. No bright lights, no sterile room, no machines. Just a small, dimly lit space filled with the smell of sweat, iron, and something worse. Old blood. Around you stand a few people. One holds your arms, another grips your legs, and in front of you is the man who's about to operate. He doesn't wear gloves. He doesn't wash his hands. And the knife he's holding has been used on other patients before you. You ask one question. Will this hurt? No one answers. Because in the Middle Ages, surgery wasn't just about fixing your body. It was about whether you could survive the pain long enough to live. One of the most terrifying aspects of medieval surgery was simple. There was no real anesthesia, no way to fully block pain. Some practitioners used herbal mixtures like opium, mandrake, or alcohol to dull the senses. But these were unreliable. Too little, and the patient felt everything. Too much, and the patient might never wake up again. So most procedures happened with the patient fully conscious. Imagine feeling the first cut of the blade, hearing the sound of metal tools scraping against bone, knowing there is no escape from the pain. The only thing you could do was endure it. Medieval surgical tools were simple and brutal. Knives, saws, hooks, forceps. They were designed for function, not comfort. Many of these tools were reused again and again. Cleaning was minimal or non-existent. The concept of germs didn't exist yet. Doctors didn't understand that invisible organisms caused infection. To them, disease came from bad air or imbalances in the body. So the same blade used on one patient might be used on the next, without any real cleaning in between. The danger wasn't just the operation. It was what came after. In medieval Europe, many surgeries were not performed by highly trained physicians. Instead, they were carried out by barber surgeons. These were men who originally cut hair and shaved beards. Over time, they began performing basic medical procedures, pulling teeth, treating wounds, and eventually conducting surgeries. In cities like Paris and London, barber surgeons became an essential part of urban life. They were practical, experienced, but not formally educated in the way modern doctors are. Their knowledge came from observation and practice. Sometimes that experience saved lives. Sometimes it didn't. One of the most common and most terrifying procedures was amputation. Severe injuries, especially from war, often left limbs beyond saving. In those cases, removing the limb was the only option. Speed mattered. The longer the procedure took, the greater the pain, and the higher the risk of death. So surgeons worked quickly, very quickly. Assistants held the patient down. The surgeon made a deep cut through skin and muscle. Then came the saw. Bone had to be cut cleanly, all while the patient was awake, screaming, struggling. Some surgeons became known for how fast they could complete an amputation, because speed was survival. Even if a patient survived the operation, the danger wasn't over. In fact, the most deadly threat often came afterward: infection. Without sterilization, wounds were exposed to bacteria, dirt, clothing fibers, unclean tools. All of it could enter the body through open wounds. The result was often devastating: swelling, pus, fever, pain that worsened instead of improving. In many cases, infection spread through the body, leading to death. Medieval people didn't understand why this happened. They might blame fate, bad air, or divine punishment. But the real cause remained hidden. War made everything worse. On battlefields, injuries were severe and immediate. Arrows, swords, and blunt weapons caused deep wounds. Knights injured in battles like the Battle of Hastings or countless smaller conflicts needed urgent treatment. There was no time for careful preparation. Wounds were treated on the ground, in tents, or wherever space was available. Blood covered everything. Pain was constant. Surgeons did what they could. Sometimes they saved lives, but often the injuries were simply too severe. Medieval medicine was based on theories that sound strange today. One of the most common ideas was the concept of the four humors, bodily fluids that needed to stay balanced. If someone became sick, it was believed that one of these humors was out of balance. So treatments focused on restoring that balance. One method was bloodletting, removing blood from the body. Another involved applying leeches. These treatments were used for a wide range of illnesses. Sometimes they helped slightly. Often they weakened the patient further. But at the time, they were considered logical and necessary. Surgery in the Middle Ages was not a clean or quiet process. The room itself told the story. The smell of blood filled the air. Mixed with sweat, unwashed bodies, and sometimes infection. There were no disinfectants, no sterile gloves, no masks. Assistants stood close, holding the patient in place. The surgeon worked quickly, focused entirely on the task. Outside, people might wait, listening, hearing the patient's cries, waiting to find out if they survived. With all these dangers, it's natural to ask one question. Why would anyone agree to surgery? The answer is simple. Because the alternative was often worse. Untreated wounds could lead to slow, painful death. Broken bones might heal incorrectly, leaving a person unable to work. Infections could spread without intervention. Surgery offered a chance, a risky, painful, uncertain chance. But for many people, it was the only hope they had. Despite everything, some patients did survive. Their wounds healed. Their limbs, though lost, allowed them to continue living. Their stories spread. These rare successes gave people hope. They reinforced the belief that surgery, dangerous as it was, could work. And over time, small improvements were made. Techniques improved, experience grew. But the process remained brutal for centuries. Medieval surgery existed on a knife's edge. Every procedure balanced between survival and disaster. Pain was unavoidable, infection was unpredictable, and knowledge was limited. For the patient, the experience was not just physical, it was emotional. Fear before the operation, pain during it, uncertainty afterward. Surgery wasn't just treatment, it was a gamble. Yet even this brutal reality of blades, pain, and survival was only one part of life in the medieval world. Because outside these small surgical rooms, entire cities were growing. Crowded, busy, full of life, but also filled with something else. Filth, waste, and a smell so strong. It could be noticed before you even entered the gates. In the next episode, we'll walk through the streets of medieval cities and uncover why they smelled so horrible and what people had to live with every single day.